Beginning the hour with that major breaking vaccine news from the United States that could have repercussions for Canada's own rollout. Officials from two key health agencies in the U.S. are now recommending an immediate pause of administering the Johnson & Johnson vaccine. This is over the risk of blood clots. J&J is the fourth vaccine to be approved by Health Canada, but it is not in use in this country. The first shipment's only slated to arrive at the end of this month. Michael Serapio begins our coverage with the breaking news and the recommendation from both, Michael, the CDC and the FDA.
Absolutely, Heather, and this is certainly a big blow for vaccination efforts in the United States, a big blow for Johnson & Johnson as well. As the U.S. Food and Drug Administration had this to say on Twitter, take a look at it. They say today the FDA and the Centers for Disease Control issued a statement regarding the Johnson & Johnson COVID-19 vaccine. We are recommending a pause in the use of the vaccine out of an abundance of caution. Now, this pause does follow news that 6 women who received the single-dose J&J shot developed a rare disorder involving blood clots, something called cerebral venous sinus thrombosis, and that prevents blood from draining out of the brain. Now, the women who were affected are between the ages of 18 and 48. One woman has sadly died. A second woman in Nebraska is in hospital right now, described as being in critical condition. Now, the J&J vaccine was meant to be an important part of the American rollout since it only requires a single dose and is easier to handle. But now the pause is expected to stop the use of the vaccine at both the U.S. federal and state levels. The CDC, we should say, will be meeting with its vaccine advisory panel tomorrow. The U.S. FDA will also conduct its own investigation. In fact, that agency will also hold a news conference at 10 a.m. Eastern time this morning, so just an hour away from now. But I do want to repeat the statement from the FDA. It says this is out of an abundance of caution, Heather. Again, we're talking about 6 cases out of nearly 7 million doses administered in the United States, but still this pause being announced today.
And I think that 10 a.m. briefing is going to be well watched, Michael, as you say, just released 10 a.m. Eastern, and we'll have coverage of that, of course, here on CBC News Network. We could also expect health officials to address this issue later this morning at the Prime Minister's own briefing. What could all of this mean for example, Canada's rollout, Michael?
Well, we can simply say that it's not going to have any immediate impact because, as you noted, while Health Canada has approved Johnson & Johnson in this country, we have yet to receive a shipment of that vaccine. In fact, it was just 2 weeks ago that federal officials confirmed that the first shipments would not be coming until the end of April. No reaction yet from Health Canada. We are reaching out at this moment in time. We've not gotten anything back yet. So, of course, we will be listening to that update from federal officials, including the Prime Minister, a little later today. But it was also very interesting to hear your conversation, Heather, with Dr. Isaac Bogosh, who basically said that even with this pause, it does not mean to say that J&J will not be useful in the fight against COVID-19. Take a listen.
It just magnifies, unfortunately, vaccine hesitancy, and that's why the communication of this has to be exquisitely careful, right? You have to be open, you have to be honest, you have to be transparent. You can never ignore any adverse event, but they also have to be framed in the appropriate context. Even if those 6 events are an underestimate, it's still fair to say that this is going to be a very, very rare event.
So a rare event, but we can tell you that Australia has already announced that it will not be adding J&J to its vaccine arsenal. And the same country will also no longer be ordering additional AstraZeneca shots, the other vaccine plagued by blood clot worries. So again, we'll be following this story very closely as it's just breaking this morning, Heather.
Michael, thank you very much.